Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew and County District Health Unit. I have great news that I want to share with you today. As of this week, the province is making available the new bivalent vaccine. Now, that's an interesting vaccine. It's directed not only towards the initial COVID viruses, but also towards the Omicron viruses that we've seen in the last 6 to 8 months. Now, it isn't the latest Omicron viruses, the BA5, for example, because they keep changing, but it's some of the earlier ones. And we think that this vaccine will not only increase your immunity as you move into winter, but will help by giving us increased immunity and increased protection against the Omicron variants. So this is all good news. Now, I know probably most people have not had a vaccine this year. So as we prepare for winter, it's time to really think about this and to roll up your sleeve and get this vaccine. In fact, you need to roll up both sleeves because the flu season's coming on, and it was much worse in Australia this past year. So you need to be protected against the flu, influenza, and against, unfortunately, more COVID. We're moving inside, the weather's getting cold, we're going to see a change. Now, the vaccine's available as of today, but in Ontario, we're targeting certain populations, those who are in long-term care homes, retirement homes, healthcare workers, and those with serious medical illness to begin with. So while the vaccine is available for everyone over the age of 18, this new booster, it's going to be another 2 weeks before it's widely available. We have a very limited supply in these 2 weeks. And as I said, we want to concentrate on those who need it most, the elderly, those living in long-term care homes, retirement homes, healthcare workers, etc. So this will be available within probably 2 to 3 weeks. So what I said is what I'm saying is you need to think seriously about getting both vaccines as we prepare for winter. Equally, it looks like we're finally out of wave 7, but certainly as we move inside, as it gets colder, we have to think seriously about additional vaccines. That's the best way to protect our immunity. It's even better, for example, than having had COVID, which many of us have had. And also remember, masking is a very good idea, very good protection in settings with a large number of people and where you don't know who those people are. And even those children in school who want to do that, they should be encouraged to do it. There should be no stigma for those who are wearing masks. We need to be respectful and tolerant. And on another note, as we move inside, I think it's very important that we think about who we're with, how many people, who we are, what we know. And finally, the most important thing is if you are sick, I don't care what you have, or even if you haven't been diagnosed with COVID, stay home until your symptoms have resolved. Don't go to work, don't go to school. This is how we can contain the COVID virus. This is how we'll be able to contain the flu and a lot of other problems. If people stay at home, if they're sick, if they're having symptoms. And certainly, whatever you do, don't go visit grandma in a long-term care home. And when you're going into those settings, a hospital or a long-term care home, please take the screening procedure very seriously. Any symptoms means you shouldn't go in, even if you want to see your mother, because it can infect her and it can affect other people, including staff, and can compromise care. So there you have it. Exciting news, a new and what we think will be a better vaccine to protect us this winter. And again, as I said, think seriously about other measures, limiting the size of your group and staying home if you have symptoms. Thank you very much.